Welcome to the next session of volunteer training program. So this is, we have Miss Jinny Joy with us. She has 6 years of experience in nursing. She has done BSc nursing, and in palliative care, she has 2 years of experience. Her areas of interest is home care. So over to you, Jinny, for the further taking the sessions.
Thank you, Cici.
Is the screen visible to all?
Yes.
Okay, thank you, Madhu.
Okay, good evening to all. I hope you all are doing well. Okay, shall we start the... Okay, today we are going to discuss about the home-based care. Okay, means anyone have any idea about the home-based care? What we need to do in home care settings?
The patient is brought back home, and instead of sending them to external public place, the patient is taken care of at home by the family members. And it's quite common to even employ a nurse to take care of the patient, or a helper.
Okay. Actually, I hope you all got many classes regarding the palliative care. Can anyone explain what's palliative care?
Care given to a patient who has chronic illness, and it could vary from asthma to cancer.
Actually, palliative care is a total care which we need to provide to the patients who are terminally ill to improve their quality of life. We should provide the care to the patient as well as the family members. Okay, in this, we have several treatments, like we can treat the patient inside the hospital and outside the hospital. So we have two type of treatment in that, inpatient treatment and outpatient treatment, and including home-based care, home care. For that, we need training to do the home care. That's why we are conducting this class for you all, okay? Then who all needs home care? Means which type of people need home care?
Choice of the patient?
Yeah, which type of patients we need to give home care?
It depends on sometimes like, patients whom the doctor feels nothing can be worked upon, and has returned, or it could also be somebody who's chronically ill. So they could have asthma, or they could have diabetes, which is not extremely serious, but it is a chronic illness.
Okay. And the thing is, who is physically unfit or unable to travel? We are providing the care to the patients who are physically unfit. You all know that palliative care is not for the care to treat the disease. We can treat only the symptoms. So who are physically unfit, we can treat them. And who is unable to travel to reach a hospital for the treatment, and in that cases we can reach their home and do the treatment for them. Okay. Then no one to bring them. We know that many of the patients are staying alone in their homes. So in that condition, if they are not well also, they can't reach to the hospital, or there is no one to bring them to the hospital for the care. So in these conditions, home-based care is important for that patient to reach their home and treat them to fulfill their needs regarding the physical care. Then financial strains. Who are under financial strains means if they need to go to the hospital and take the treatment also, if they don't have the money, they won't go to the hospital due to the financial problems. So in these conditions, we can go and treat them according to their needs. In this picture, you can see different type of homes. There are many walking distance to reach the hospital. So in these conditions, we can go there and treat them. For example, suppose there is a patient who is catheterized, you all know that we should change the catheter within 3 to 4 weeks. So is it possible to bring that patient every time to the hospital for the catheter change? No, they can't bring the patient every time to the hospital. So it's better to give the treatment in their home. We can go and do the catheter change in their home. That may help the patient and the caregiver also. So walking distance to get the transport may need to be carried to the hospital. So it would be better to get treatment in their homes. Okay. Then what are the components of home-based care? The components of palliative care is including physical care, emotional care, social care, and spiritual care. So the components of home-based care is also same like that: physical care, emotional, social, and spiritual care. Now we'll discuss about the physical care. What are the things we need to do in physical care? In physical care, first thing is assessment and treat the symptoms. We all know that palliative care, as I mentioned before, palliative care is not the care for the treatment of the disease. It's a treatment for the symptoms. Okay. So first, whenever we reach the patient and whenever we see the patient at the first time, we should assess the symptoms. What are the symptoms they have? Maybe, for example, patient is suffering from cancer. They have pain or something. So we should assess the pain and we should treat the pain first. So according to that, firstly, we should assess the symptoms and treat the symptoms. Then provision of physical aids. So if we are providing physical aids to the patient, that will help the patient because, for example, patient had affected with a stroke or something. At that time, they are not able to walk around the home due to the disease. If we are providing the wheelchair to the patient, that may help the patient to roam around the home with the help of wheelchair, and we can provide walker and tripod and everything. And if we need to take a consultation from our physiotherapy team also, we can take and provide the necessary physical aids to the patient. That would be more helpful for the patient as well as the family. Then follow-up is very important in physical care. If we are going to give the treatment once a time, it won't be help the patient or family because one-time treatment won't help the disease or won't treat the symptoms. We should do the follow properly. Then means according to the condition of the patient, we should prioritize the patient. Is necessary to do the weekly follow-up or twice a week follow-up or monthly follow-up. And we have a lot of patients who are under 2-month follow-up also. So according to the condition of the patient, we should prioritize that. Which type of follow-up we should do the patient. So according to that, follow-up should be done and do the necessary things. According to that, we can identify our treatment is beneficial for the patient or the caregivers. Okay. These all are the things we need to assess in physical care. First one is assessment and treatment for the symptoms, and provision of physical aid and follow-up is very important in this care. Okay. Everyone understood regarding the physical care? Then we'll move on to the emotional care. In emotional care, what are the things we need to assess? The thing is, many of the patients have fear, anxiety, suicidal thoughts, guilt, loneliness, and feeling of burden, being a burden, and loss of meaning in life. These all are the issues, emotional issues they have. Most of the in our settings, most of the patients have these much of issues. So when we visit the patient, we should assess these things and treat that. So many of the patients have fear regarding their disease and fear to death, and they are very anxious about the condition. What will happen next, and what will happen in means is it curable, or means what will do in further. So we can discuss the things to them, and we can explain the condition and everything to them. That will reduce the stress. And many of them are feeling loneliness because of the condition. They itself try to become isolated. For example, one patient has wound in buccal cavity. He has CA, cancer. So they have buccal cavity wound. So they should not try to expose in their family members, or they are not interacted with the friends, because due to the wound, they try to isolate themselves. They don't want to show the wound and reply for the questions which is getting from the friends or family members. So these all are the things commonly we can see in the patients who are affecting with the diseases. So we should assess these things and do the needs. And many of the patients have suicidal thoughts due to their condition. So if they means they feel that I can't do anything for my family, or I can't do anything for my children, or means I can't do anything for anyone. So it's better to die. In these conditions, we can identify the suicidal thought, and we can do the further things like we can refer the patient to the psychologist, or we can give the counseling to them. So emotional care is very important. We can give all the instructions to them to reduce the emotional stress. So then the next one is social care. In social care, as you all know, means if we have no job, so we'll get financial problems. So if there is a patient who can't go for the work, there may be chances of loss of money. There will be no money and no food for the patient as well as the family members. And for the treatment, they might spend lots of money, so they can lose their land and home. So they can't provide proper education to the children, and unable to get children married, and no status in society. In this generation, we can know that if there is no money, we don't get any proper status in our society. So this is the main thing we can see in many of the patients who are suffering from diseases. So we should identify these things while we visit the patients, and do the, we can help them. For example, if patient is paraplegic, they can do the things with their arms. So we can encourage them to do the rehabilitation works, like we can educate them to make an umbrella or do some other works. We can put a petty shop to them, and because they can earn from their own, and they can take care of their family. And if patient is affected fully, we can train the caregiver. Husband is affected, so caregiver can't go for job in many cases. At that time, we can train them for example, for stitching and all. We can train, and they can earn by their own. It will help the patient to improve their financial status. Then we'll move on to the spiritual care. In spiritual care is not related to the religion. Many of the patients have the questions like, why God did this thing to me, and my mother is very nice person, why it happened? These type of questions they have. So when we reach the home, when we go for the home care, they definitely ask these questions to us. So we should explain the condition. We should explain each and every condition to the patient as well as the family members regarding the disease and the further problems related to the disease. And we should reduce the stress and we can treat the symptoms. It will help to reduce their strength. Okay. Then for these all things, we need to do a home care. So what all are the things we need to organize a home care service? Home means we all discuss about the home care means components, but we need a organization. We need to organize to make a home care service. So what all are the things we need to organize? First one is a vehicle should be there to travel. Then home care kit should be there. In home care kit, which includes medicines, procedure bags, and vitals box, everything should be there to reach the patient. If there is an emergency or if we need to provide the medicine to them, it should be carried by us. Okay. Then trained volunteers should be there. That's why we are doing the training for you people, because trained volunteers are our strength. So we need to train volunteers and trained healthcare professionals. Means all who all are giving palliative care to the patient, we should give training to them. If a trained person only can identify their feelings. Then team meeting and discussion should be there before going to meet the patient, and after come back from the home care also, there should be a discussion regarding the patient in between volunteers, doctors, nurses, social officers, and everyone. Then regular follow-up is a main component. These all are the components to organize a home care service. This is the picture of home care kit. You can see that in right side it's a medicine box, left side it's a vital box and necessary papers. So we have three bags. One bag which includes medicines and syrups, and the next one vital box is there. Procedure bag is also there, and some few of the important papers should be there with us. We should carry that to the patient side. Then types of home care. We have 4 types of home care. First one is DHC. DHC means doctor-led home care, which includes doctors, nurses, social officers, volunteers, and PCS, palliative care assistants. And the next one is NHC, nurse-led home care. It includes nurses, social officers, volunteers, and PCS. Then social work-led home care. In this, if we did the nursing home care as well as the doctor's home care, we identify that patient is struggling a lot or social. We need to assess the socioeconomic status of the patient so that we can send the social work team to them and for the further assessment. That's why there should be a SHC, social worker-led home care. Then VHC is also there, volunteer-led home care. If a trained volunteer go and identify the condition of the patient and they can prioritize the patient. Means they can identify if there is a need of DHC, NHC or SHC. So that's why a trained volunteer-led home care should be there. These 4 types of home care we have. Then in emotional support, communicating with the patient, it's very important. Communication is very important in palliative care. So for the communication, we don't give the money, we don't want to do anything. Just go and communicate with the patient for a few minutes. Okay, go and sit along with the patient or sit along with the family members and just listen them what they want to say us. Okay, it would be very helpful for the patient and family members. And exploration of problems. If we can't explain our conditions to a stranger, so we'll do the regular follow-up and we'll talk with the patient and family members in that manner. They can explore all the problems with us. If we are going to do a home visit at the first time, there are less chance to explain their condition to us. So we'll do the regular follow-up and try to explore exploration of their problems. Okay, that would be more helpful for the patient, and we can treat them according to that. Then general hygiene in bedridden patients. Mostly we are doing home care for the bedridden patients. So general hygiene is very important in bedridden patients. First thing is ensure the client is getting daily bath. If a caregiver is very healthy, they can provide daily bath to the patient. It's better. But in many cases, caregiver is fatigued. They can't take the patient to bathroom and give them bath. So at that time, sponge bath we can advise to the patient. We know that if we are not taking bath every day or twice in a day, how we feel? We are not feeling good, no? So what about the bedridden patients? They are also need to take bath and everything. So we should ensure that patient is getting daily bath as well as a sponge bath. Then proper skincare should be advised because bedridden patient is more prone to the bed sores. So we should advise proper skincare to the patient. And oral hygiene is also very important in this case. If we are doing brush, it's once a day or twice a day, but they are not getting the brushing and all. So we should train the caregiver to do the oral hygiene. Otherwise, oral thrush can happen and it will spread to the oral cavity and it cause many disease to the patient. So oral hygiene is very important in general hygiene. And next we'll move on to the bed sore prevention. In this picture, we can see a bed sore. So for bed sore prevention, we can do general hygiene. First one, as I mentioned before, the 3 points is very important in general hygiene. Then skincare is also, we should advise them to do the skincare properly by using petroleum jelly or liquid paraffin and everything. After giving a bath or sponge bath, we can advise them to do a proper skincare. Then comfortable device. Comfortable device should be provided like air beds or a proper bed sheet and mattress. Everything should be provided to prevent the bed sore. Then follow-up care is also should be there. You can see the other bed sore here. This is 2 type of mattress. Can anyone explain which type of mattress is this?
Air bed and water bed.
Yeah, thank you. This is one is air bed and next one is water bed.
There also a ripple bed too, the capsule mattress.
Okay.
So I think next we will be having a video about bed making. We can go to the video now.
Can you stop share it?
When is airbed used and when is waterbed used? Is there any specification?
Wherever the electricity or supply is not available, there you can use a water bed, and wherever you have an electricity supply is possible, then you should have to use air bed. If water bed has been leakage, then whole room of the patient will be flooded with the water. It was something like 200 or 250 liters in that particular water bed, and it was quite heavy. And it might be possible to change water every 15 to 30 days because the water is going to be a smell out somewhere. But airbed doesn't have such kind of this kind of options are there. As much as good I have a knowledge about it, you can easily
Thank you.
close that water bed or air bed, but you can't be close the water bed as soon as possible.
regarding the video of bed making. So next we will go on to the oral hygiene. So you can see two pictures there. Can anyone identify the difference?
In one picture, he's sitting up. In the other picture, he's lying down and brushing.
Correct. One patient can sit and do the brush, and other one can't sit. Okay. So we can move on to the next video that's related to oral hygiene. I hope you all understood regarding the oral hygiene. Okay. So next we'll move on to the self-care education. So we can provide self-care education to them if they are conscious and oriented. That brush the teeth twice a day with a soft toothbrush. And toothpaste left in mouth can cause dryness. So advise them to do a proper mouthwash after doing brushing. Okay. Then rinse the mouth with warm saline or soda bicarb solution. Tongue to be brushed with soft toothbrush and take plenty of fluids to avoid the dryness. And denture should be removed at night. These are the instructions we can give to the patients. Oral hygiene in terminal patient, we already showed the video to you people. Then how to prepare the homemade saline. We have two type of salines, like one is homemade saline and soda bicarb solution. In homemade saline, water or 0.9% sodium chloride prepared. How to prepare the sodium chloride solution? 500 ml of water and add 1 teaspoon of salt and boil it well and allow it to cool and keep it in a good container. It can use as a saline water to clean the wound and to clean the oral cavity and everything. It's a how to prepare the means prepare the saline solution means 500 ml of water needs 1 teaspoon of salt and boiled it well and allow the water to cool. And after that we can keep that water in a clean container. And we can use it to the wound care or oral hygiene. It's same as our normal saline, 0.9% normal saline. Then for the preparation of soda bicarb solution, 500 ml of boiled water plus 1/4 teaspoon of baking soda. In this, we should add baking soda in boiled water. But in the previous case, we need to boil after adding the salt. This is the difference. Okay. Then we'll move on to the catheter care. If we are going to the home care or home-based care, means many of the patients will be catheterized. So we need to educate the caregiver regarding the catheter care. So if catheter care is not giving properly, there is chances to getting UTI, urinary tract infection. That's why we are giving proper instructions regarding the catheter care to the caregiver. If patient is conscious and oriented, we can educate the patient also. First one is catheter change. We have two type of catheters. One is Foley's catheter and one is silicone catheter. Foley's catheter should be changed within 3 to 4 weeks. Then silicone catheter we can change within 3 months. Okay, this is a different type of catheter and changing time. Then strict aseptic practices should be advised. advise the caregiver that while they are doing the care to the patient, they should clean the private part with normal soap and water. And they can do the catheter care with antiseptic solutions like betadine or Nusets. Okay. They should clean the catheter from unhygienic area to hygienic area. Sorry, hygienic area to unhygienic area. Then perineal care should be advised to them. In perineal care, we can use normal, as I mentioned before, they can use normal soap and water to clean the perineal area. Then advise the catheterized patient to drink more oral fluid unless and until there is a restriction. So oral fluid can improve the urine output. So they can, there are less chance to a UTI. So we should advise the patient as well as the caregiver to give more water to the patient. Then bowel care is very important in catheterized patient. If you can think that why bowel care is very important in this case, this type of patient, because if patient had complained of constipation or something, there is chances to compress the catheter. So urine should be remaining in the bladder. So UTI will happen in this case. So bowel movement should be important in this case. So patient should be move their bowel once a day as well as once a 2 days. Okay. So we should observe the constipation in catheter patient. Then ensuring compliance. Ensuring compliance means proper instructions we should given to the patient to take the medicines. Many of the patients are not able to read the things, and many of them can't understand in which time we need to take the medicines. So there should be a medicine compliance should be there. So we should instruct the patient and caregiver regarding the medicine and give proper instruction regarding that. So when we provide the medicine to them, proper labeling and name of the medicine and what time they need to take the medicine. These all are the things we should write it in a medicine cover and fill the medicine in that cover and give to the patient. Then check the number of medicines in each visit. We know that if we are going to do a visit in next week, so we should provide 1 week medicine to the patient. And when we do the next visit, we should ensure that patient, how many medicines they left or it's finished or not. If they have enough medicine, that means they don't take the medicines properly. For that identification, we should check medicines in every visit. Then consider the financial status. So if we are going to, we can prescribe any medicines to the patient according to the conditions, but we should observe for the financial status. If we go and see the symptoms, we'll prescribe high cost medicines to the patient. And we'll come back to the hospital, but they can't bring that because they don't have the money to bring that costly medicines. So whenever we should prescribe, it should be according to their financial status. Otherwise, we try to give that medicine to the patient. Then what all are the benefits for providing this much of care to the patient? Can you think that what all are the benefits they get due to this care we are providing? Then we'll discuss about the benefits. Patient and family feel support. So many of the patients are staying alone. So at that time, if we are doing the proper visit, proper follow-up, they feel very comfortable. They feel that somebody is there to care us. Somebody is there to listen us. So they feel very support. Then patients receive individual attention. In hospital or in a rushed OP, doctor will see the patient and they have a lot of patients to see within this hours. So they can't give more attention to the patient. But in home care setup, we are seeing only one patient at a time. So we can give more individual attention to the patient and less social isolation. If they are feeling socially isolated, we are doing the regular follow-up to the patient. So we are going to the patient and talk with them for a few minutes or few hours. So they feel somebody is there to take care of me. So patient social isolation will be decreased. The patient remains part of the family. In our home care settings also, many of the patients wait for us to give something to us. Means they know in this month, this week, they might come to meet us. So they'll prepare something for us. They are thinking that we are also the family members of their family. So remind patient part of the family members. Okay. Then full assessment of the patient and family. We can assess the all condition of the patient as well as the family. So in many hospitals, everyone are treating the patient. They don't try to understand the condition of the caregivers. Maybe they are stressed or they are not well. They don't want to know about the caregivers. So in palliative care, we are giving care to both patient as well as the family. So understanding of condition of the family members is also happening here. Then understanding of family dynamics. Prepare the patient and family for any anticipated difficulty and symptoms. As I mentioned before, if they are in any trouble, we can identify the things and we can prepare the patient and family members to overcome that situation. Now we can think that obviously you all have a question that how it will happen. How it happened, I mean, these things we can provide, but how it happened and how we can do that. So that's answer is training to everyone. So teamwork is the main thing to fulfill the things which we discussed before. Teamwork means together everyone achieves more. So teamwork is very important in a palliative settings. So we have a team includes clinical teams, non-clinical teams, and in clinical teams which includes doctors, nurses, physiotherapists, volunteers, and social officers, everyone will be there. And non-clinical team, all the technical and non-technical staff should be with us. So teamwork will help us to fulfill the needs of the patient. So the team includes volunteers, social workers, nurses, doctor, physiotherapists, and etc. Okay. All the members who are working in a team, they need training to work as a palliative staff. So that's why we are providing training to everyone. So we all know that we can't cure 100% of diseases and we can't relieve 100% of problems in everyone's life, but we can provide comfort to the patients as well as comfort to the patient. So for that, we don't have to do more. So to cure sometimes, to relieve often, to comfort always. Okay. Thank you. I hope everyone understood regarding the home-based care. Thank you.
Thank you, Jinny. That was a wonderful session. Hope everyone understood how a volunteer can help out in a home-based setting. How you can provide care at home. These all are something that a volunteer could also assist. Now, these are the care which a volunteer can also assist in. Usually, it needs medical training also, but you can assist the person or you can help them to get this care from a nearby center or whatever way you can help as a volunteer. We have got few queries in the chat box. We'll go one by one. First question was, do you use some kind of instrument to assess those feelings, emotions, ideation? The above question refers to the emotional assessments.
Actually, we don't have any instruments to identify the feelings, emotions, and ideations. We are identify their feelings by communicating with them. By the communication, we can understand what are the feelings they have, in which type of stress they are under. So, according to that, we identify and rate them according to that.
I have a question. How does the palliative care team take care of their own emotions and, the impact of they see people in their last stages every day? So how do they take care of their own, burnout and emotions?
That was a very good questions, Madhu. Sorry, I'm not sure who what you are, like a doctor, a nurse, or just a volunteer. I I was working as HR in at Pallium India before, working as a national coordinator. Before that, I was working as HR. So we usually conduct, employee engagement activities,
Okay.
regular trainings, so that they can, and we have, meetings with everyone, so that they can open up their stress and whatever they have.
Okay.
So that's how we manage here
Okay.
the stress and burnouts. We do have like you rightly said, we do have people facing death every day, like
Sure.
especially in our inpatient unit.
Yes, true.
That's very, very tough for our team members. So we do have regular sessions.
Okay.
And in case of where we cannot manage, we take help of other consultants, outside consultants, for some counseling or something like that.
Okay.
That happens regularly.
Okay, thank you.
Thank you. Most welcome. So the next question is the above question. Do you refer patient to a spiritual care specialist if he keeps bringing spiritual suffering? I think we answered this question in the previous session, like with the psychosocial assessment thing. So while Reena was taking the sessions, we can bring in people who can, counsel in this matter. So if there are specialists, we do take care or we do, take help from them. So that happens. We don't have any specialists here working with us, but we do refer it outside if there are any cases. Luckily, we don't have such cases often. So, okay. James, you have raised your hand. Is there anything else you want to ask?
Yes, ma'am. Thanks for the wonderful training. I just want to know, when are we going to access the materials on the website or through our emails? Because I was going through the portal, but still more, the session that we have conducted, they are not uploaded there. There is no any videos or PDFs. So I was just requesting and also to know when they will be ready, because like for me, I'm a student, so these information are very relevant to my studies. That's why I'm requesting.
Okay, you want the videos and the PPTs, right?
Yes.
Okay,
actually, the PPTs will be shared with you. I think all of you have registered with the IFO. In that IFO, there is a content page. In the content page, all these video links along with the learning materials, including this PowerPoint PDFs, will be updated. It will be done by Saturday evening, before Saturday evening. Thank you.
Okay. Thank you, ma'am.
Most welcome. Okay, I hope, Maria, I had answered your query. Sorry, ask you. Maria had put up the question on spiritual suffering. Okay, I think she's lost. Okay, we'll go for the next. Can we use mild antiseptic along with?
Hi, thank you so much. Yes,
Yeah, okay.
you answered. Thank you so much.
Thank you. So, okay, can we use mild antiseptic along with saline? I think it's for bed sore or catheter care. What?
Actually, normally in our settings, we are not using any antiseptic solutions along with the normal saline. First, for the catheter care, we are advised that first do the cleaning with the normal saline, and after that, we can use a strong antiseptic solution to clean the catheter. In bed sore, in palliative care settings, we are normally not using antiseptic solution to do the dressing, and we are only use the normal saline and further medications according to the wound.
Okay. Okay, situation by Satya Sai. A daughter of a dying father asked, "My father always prayed to God. He was a good man. Why didn't God help him? What do you think the best answer would be?"
Actually, this thing is, we already discussed that this is regarding to the spiritual issues. In that, they definitely ask this type of questions due to their emotional stress. So in this thing, we should explain the condition. We should try to convey total condition to the father. So in this, we can't answer that God will try to reduce your, God will help you to cure your daughter or something. So we can't predict the future. So we can do the thing is we can explain all the condition and each and every condition and according to the stage by stage to the patient as well as the caregiver. If patient is under pollution, means patient don't know regarding the disease, we can explain all the things to the caregiver. So I think you people get more classes regarding this in communication section. Is it over? I think.
Yeah, communication was yesterday.
Yeah, in that discussed everything detailedly.
You'd have got an insight on how to communicate and what to communicate to a patient and the caregiver in the last day session. So based on that, then break the news to the
How to break the
patient.
bad
Yeah.
news and, I hope you all got an idea regarding how to break the bad news and
Yes, you got a thank you from Satyashree. So, okay, what was the next question? Can you go up? Okay. Will the patient be able to tackle the situation if he comes to know he or she is going to die? Hema. You know the answer? Will the patient be able to tackle the situation if he or she comes to know that he or she is going to die? It will base on your communication to them.
we can't
The way the way you communicate with them will answer that question actually. Next is yes, thank you for the session. Just a simple thought, which care do you think is better, a home care or a hospital care to help improve the quality of life?
Actually, it's totally based on the condition of the patient. If patient is having a huge bed sore, they don't know how to take care of the bed sore. In that case, we should take the patient to the hospital and prepare and educate the patient as well as a caregiver to do the bed sore and bed care, proper bed sore care, and after that we can send the patient to the home. And if patient is not physically that much ill, we can send them to the home and teach them how to do the things. So if patient is very vulnerable in under a severe pain, they can't manage it at home. In that condition, we should hospitalize the patient and to do the treatment to reduce the pain. So according to the condition, we can divide the patients like hospitalized patient and home-based care patient.
Okay. So, and how can we as a volunteer we can be, like, how can as a volunteer we can be helpful to them? Okay, I'll answer your question. I'll give an example. We have a volunteer. We have many volunteers, but I would take one example because his name is Nair. We call him Nair Uncle. What he used to do is okay, I'll share the story first. He came to us when his wife was under treatment for palliative care with us. Then only he came to know about us. When his wife passed away, he became our volunteer. And since then, he was our volunteer. It has been around 8 to 9 years that he is with us. He is a 70-year-old guy. And he is volunteering with us since last 10 years. Let take it 8 to 10 years. And what he does is he's not a medical person. He is a ex-serviceman. He was in army, Indian Army. And what he does is he goes with our home care team. Like every day we have 8 teams going out for home care, each consisting of a doctor, nurse, and a social worker, basic unit. And he goes along with them. He goes to every patient's home, like he goes in the city premises, around 20 to 30 kilometers in and around the place, like where we are located. So he goes to each and every patient. Every day we have home care, city home care. He goes to each and every patient. He knows what the patient, he knows everything about the patient, what his name, he notes everything down in his small notepad that he has with him. He knows everything in a chutki that we call, no, in Hindi we call it chutki mein, he knows everything. So when we ask, we give him the code number, he knows the patient, he knows everything about the patient, and he has the contact number also. He contacts the patients every day, asks him, what are you now feeling? What's your condition now? Is there any problem that you are facing? What help should we do to you? It's his, he thinks that it's his responsibility. It's not that we had assigned them, like him, to do these things. No, our team goes, takes the physical assessment, the social officers takes the psychosocial assessment, the doctor gives the physical attention, the nurse gives the physical attention. Everything is done by our team, medical team. So the volunteer, he being a non-medical person, he inquires everything about the patient and he knows everything about the patient. And the patient is more comfortable with him than our team. So that's the relation that he builds with the patient. So he knows everything on the tip of his fingers. And so that's how a volunteer should be. It's not that we have assigned him anything. It's by his will only he is doing. And that's what we want as a volunteer. A volunteer should be a person who does everything by his own. And that's the satisfaction level he has. He's still with us. He still goes to home care. Right now, he is not well. He has got a fracture on his leg and he is bedridden right now. But till date, when he got the accident, he was in our home care team as a person who can take care of the patient. So that's how a volunteer should be. Hope I have answered the question, Shima. You can do anything for the patient. Leave the medical part apart. The non-medical part, if you are a medical person, you can do the medical part also. If you are a non-medical person, you can do anything for the patient. You can sit aside, you can go to their home, sit aside, have a conversation with them like a family member. Now Nair Uncle, they call him Nair Uncle. Nair Uncle is a family member to each and every city patient. Every patient knows him. And first call goes to him when they are unwell, not the team. Ideally, the team should get the first call, but the patient calls him first because that's the relief that they got. Thank you. Do the volunteers collaborate in some kind of bereavement work, like groups with families who lost a loved one? Yes, we have a group named UNARV. That's a Malayalam term, UNARV. We have a group like that. So it's a volunteer-led group in which all the bereaved family members will be there. So every month they'll be meeting. Since it's COVID, it has changed to online platform, but they are not preferring that thing. So they come here at Palem India every last Saturday of the month. They have a group, they discuss their problems, they have fun, a 1 hour, 2 hour gathering. They discuss, they have, they play games, they sing song, whatever they feel to, whatever they feel to make them relieve everything. And this group is led by volunteers. So volunteers have created a group. They talk with these family members, and if we find that there are, we don't interfere in that. Like Palem India employees don't go and interfere. The volunteers take the lead of that, and volunteers talk to them and understand what all problems they are going through, and if there is any medical or social assessment that is required from our end, they'll inform us. Otherwise, they are the ones who take care. We don't have any psychologist in the group, like no volunteer psychologists in the group. These people, these are retired people. The volunteers that we have are retired people. So, they are leading their retirement life, and they help these people overcome their grief. So we have a group like that. Every month we meet on last Saturday. Okay. Thank you. You are such an active participant, Maria. Thank you.
It was a participant information was in palliative care.
Oh, wow. Wow. Thank you so much for being part of this. Anything else that anybody wants to ask? Okay, so if there is nothing, so Jinny has done her part so well that no doubts are there. Otherwise, the session should go until 6:30. So we are winding up at 20 minutes earlier. So thank you so much for Jinny for being part of this training, and thank you everyone out here for being such an active listener. I'm getting, every day. So okay, one more question. Do volunteers have some kind of systematic supervision meeting? Yes, we do have. We do have. Every month on third Monday, we have monthly volunteers meeting. So every volunteer who is associated with us gather together here at Palem India. Senior management people, coordinator, volunteer coordinator. A person is there for volunteer coordinator as a volunteer coordinator. So the team sits together, discuss the challenges that volunteers are facing, the things that volunteers can do. We assign a lot of works. Volunteers are very happy to get all the works done. So whichever our team is not able to do, because we have limited members here. So being a charitable institution, we have limited resources, and these volunteers are our strength. So we do have meetings, in-person meetings with everyone here. Thank you. We lost Maria again. Hope I have, yeah, okay. What you? Hope I have answered. Yeah. So, okay. Thank you everyone for joining in. Hope you all heard about the experience sharing, which I mentioned in the last session. So tomorrow is the last day. So if you can share the write-ups to the email, tipseco email, tipseco@palemindia.org. I think Sinia will share the email ID in your groups and email box. So you can share your write-up, which email IDs. Carolyn is asking which email IDs. It's tips.
I will share the mail ID in your WhatsApp.
We'll have a WhatsApp group and we'll share the email ID in that WhatsApp group. So you can share your write-ups on. Can you please repeat the question? Which one? Write-up. Okay. You have to share a write-up on your palliative care experience, whichever you have experienced in your in your life. You can share that as a write-up with our training team. It's not an assignment, it's just a part of learning so that we understand what you have understood from our session and what your experience is. We can learn mutual learning. It's a mutual learning. So about a palliative care experience that you have. A small write-up. We have not done, we have not limited it to some words. You can write a story. And if we like the story, we'll publish it in our Sahayatra and blogs if you want. So that can be done. Any other questions? No? Okay. Thank you. Thank you so much. Okay, see you then tomorrow. Bye.
The feedback link will be sent.
Yes, please. Bye.
The feedback link will be shared to your WhatsApp group. Thank you all.